Welcome to a new edition of Spotlight Leaders, a series of interviews by Hot Science Balloon, where we talk to leaders in healthcare and biomedicine about their personal motivations, career paths, as well as the successes and challenges when leading an international organization. This time, it is our great honor and pleasure to welcome Dr. Soumya Swaminathan, who is the Chief Scientist of the World Health Organization. Dr. Swaminathan is an Indian pediatrician and also a renowned expert in the field of tuberculosis and HIV. After getting her MD degree in India, she gained additional medical education in the United Kingdom and the United States of America. She held several leadership positions in healthcare in India, after which she transitioned to Switzerland to join the World Health Organization and become the Chief Scientist. It is a great honor and pleasure to welcome her, and please enjoy the interview.
Dr. Swaminathan, thank you so much for joining us today.
Hello, very nice to be with you, Alen.
Thank you. So we can start with the first question. You were born in India, actually, and your father is still a world-renowned agriculture scientist, but yet you kind of ended up and pursued medicine. What attracted you to medicine so much, and how big of an inspiration was your father, even though he was in a separate field as you are?
Yes, so when I look back at my childhood, it's clear that it had a big influence on me, because I grew up in a research institute, an agricultural research institute. And so in the evenings, what I saw was a lot of students in our house sitting with my father. Of course, they were discussing their research work and their master's or PhD theses. My mother was a preschool educationist. And so I saw also the kind of work that she did with preschool children. And she believed that that was the most critical part of brain development and cognitive development. And I often got to go with my father to the lab or to the fields. So I had a feel for research from very young age, and I was very motivated to do research. I also loved animals, and I always had a variety of pets in the house. And so I actually wanted to be a veterinarian. But one summer holiday I got as a 14 or 15-year-old high school student, I got the opportunity to spend a summer holiday with a geneticist, colleague of my father's who worked in Kolkata. And I worked in her laboratory trying to do karyotyping of chromosomes. In those days, genetic techniques were not as advanced. And we had this patient in the hospital who had delayed puberty, and she was being investigated. And I discovered that when I did the karyotyping, instead of 23 pairs of chromosomes, the sex chromosomes, actually one X was lacking. And so she had only one X instead of two X's to make her a female. And that had then resulted in what was called Turner's syndrome. And that actually gave me a huge kick and a push actually into understanding medicine and diseases better. And then I was also encouraged by my father, who said, you can still pursue your interest in research or interest in genetics after you get a basic medical degree, because it might give you a better understanding of the human body and how it. So I then, did the entrance exams. I got into a medical school and I pursued a postgraduate degree in pediatrics. But all along, my fascination was for research. And so after I did a fellowship at the Children's Hospital of Los Angeles, where I actually learned research methods, I then went back to India and specifically looked for an institute where I would be able to devote time to research.
Right. Very noble cause, and that's great to hear. And you're also specializing in the field of tuberculosis and HIV. Can you maybe give us more context why those specific fields?
So actually, my training was in pediatric pulmonology, respiratory diseases. And when I went back to India from the US and the UK, where I'd spent 3 years training, that's what I wanted to do. But then I realized as I sat in the clinic there that tuberculosis was a huge public health problem in India, sort of neglected from the research point of view. And certainly pediatric tuberculosis, there was a lot that was not known about the disease. It was misclassified, misdiagnosed, often mistreated, either over or undertreated. So this is how I got into tuberculosis research. I also found my niche at the Tuberculosis Research Center in Chennai, where I could really pursue multidisciplinary type of research, which is what I was interested in, where I could combine some immunology with clinical work, but also then build more laboratory backup facilities as we started our work on HIV. Now, HIV was discovered in India in 1996, and it became clear in a couple of years that this was going to be a big public health problem, and that particularly its relationship with tuberculosis, already recognized in sub-Saharan Africa. But India also sort of became almost sort of the epicenter of the HIV-TB syndemic or co-epidemic. And being based at the Tuberculosis Research Center, it gave me a very good platform to expand into HIV-TB research. And there was so much that was not known. So we started many clinical trials of optimal treatment regimens, prevention regimens, also understanding more about disease progression, the opportunistic infections that arose. And in those days, not many physicians in India had experience dealing with late stage HIV. And I remember that there was a lot of even simple, what we take for granted today, cryptococcal meningitis and pneumocystis. We know these are opportunistic. In those days, these were not accepted unless we provided the data and the laboratory confirmation, which we were able to do. So I think that really also opened up the whole area of social and behavioral sciences and research for me, because it was clear that both with TB and HIV, that a biomedical approach alone was not sufficient. And that if you needed to have success either at the individual patient level or at the more community level, that you needed to understand the social context and the other determinants of disease. And so I built also a team of social and behavioral scientists with whom we did some very, very interesting studies, including randomized clinical trials of different behavioral interventions.
Right. I mean, yeah, very, very interesting, the career course and why you actually chose to focus on tuberculosis and HIV. Great. And now you're the chief scientist of the World Health Organization, but you also held many other leadership positions. So why did you decide to go maybe from like basic research to leadership positions in healthcare?
In a way, it's been I would say quite serendipitous in how my career evolved. It's not that I had planned for any of these things. At some point in my career as a research scientist, I became acutely aware of the gap between research and policy, and the fact that we seem to be working in a silo, that our work was not having as much impact on policy as I would have liked to see, or at least, quick, rapid impact. And so as I became the director of the Institute, I recognized the need to work with policymakers and with a number of other stakeholders, both at the state and at the federal level, in order to have that kind of impact. And then I got the opportunity to become the head of the Indian Council of Medical Research, which is sort of the NIH equivalent in India, which gave me an opportunity to go beyond TB and HIV and really look at how sort of evidence and research and evidence can lead to policy action, and also start looking at ways of strengthening clinical research capacity across the country, across all of our medical schools, and so on. So that gave me a much broader view also of the public health challenges that India is facing, and the huge gaps in R&D and in access to new technologies that our populations had. So I guess I was quite content to be playing that role as a head of the Medical Research Council in India when Dr. Tedros, who had just become the Director General of WHO in 2017, he reached out to me and invited me to come and join him in his leadership team. Initially, the role was a little bit different. It was more of a coordinating role across all of our disease programs. But then we created, WHO went through a transformation. A science division was created, a new position of chief scientist was created. This was 2019. And I then moved into that position, which was very exciting because it was the first chief scientist I had to actually design and develop and nurture a new division with new roles and responsibilities that go across WHO, but also reaching out to the wider scientific community around the world and bringing in those linkages, because WHO traditionally works with health ministries and physicians. but reaching out to the broader community of scientists, the different science academies and so on, I think that's been a sort of a value add that we have been able to bring.
Right, right. It must have been challenging creating the whole new division of
Yes.
the WHO. And
So-
can you maybe share with us like some of the challenges that you faced at the beginning while you when you accepted the position as the chief scientist?
Well, WHO is a huge organization, not just based in Geneva, but we have 6 regional offices and 150 odd country offices. And so I think the biggest challenge really is to have sort of one vision and one way of working and making sure that what we do in Geneva actually has meaning at the country level, translates into action. So one of the first things we did was to listen to people working at these different levels, particularly in our country offices, to hear what are your challenges? What is it that you are asked to do by the Ministry of Health that you find difficult to respond to? Or what can we do better to support you? And this resulted in a series of things which started really with just having really high and rigorous standards for all of our normative products and moving our, WHO is the normative agency for health in the UN and in the world. It's the one global agency with 194 member states. So we have big impact in the guidelines that we make. So we wanted to make sure that they're based on the most recent data and science and evidence, and they're continuously updated, and that they're available in digital platforms so that ultimately countries can choose to adopt our recommendations as decision support tools for either physicians or nurses or even community health workers. So that's the vision. The other big goal of the science division was really to try and be ahead of the curve. We're often caught in a situation where we're being responsive to a situation, a crisis that's happened. Whereas what we would like to have is anticipate perhaps the big scientific and technological innovations that are going to happen in the next 5, 10, 15 years, and be able to say, okay, how do we prepare ourselves and how can health systems around the world prepare themselves for these big changes? Artificial intelligence is a good example. So we set up a committee to look at what should be the ethical and regulatory frameworks to govern the use of artificial intelligence for health. Now that report is a very practical kind of a report which actually lays out what actions need to be taken in a country to make sure that you leverage, the good things about AI, but at the same time you mitigate the risks. Right. Similarly, we identified genome editing as a technology that has huge potential to cure diseases like sickle and HIV. And you're a neurologist, so you know that there's huge potential there. But at the same time, as we know that it can be misused, and particularly when it comes to germline gene editing, it's a very dicey field. So we came up with recommendations on the regulations, but also recommendations for WHO on what we should be doing for the future to safeguard and to make sure that research is done in a ethical and responsible way. So those are just 2 examples of where the WHO Science Division plays a role in convening experts from around the world to set sort of a global norms on new technologies.
Right, right. I mean, those are all great goals, and I wish you all the success in achieving those goals. And as you mentioned, facing big challenges. I mean, in the second year of your term, COVID unfortunately struck the whole world. I mean, can you share with us like the initial challenge that you faced when you actually found out that it was spreading so quickly, and how did you deal with those challenges?
So within 9 months of creating the science division, we were into the pandemic. It became clear within the first few days that this was going to be a big problem. And we also knew very little about this new virus. Luckily, thanks to genome sequencing and all that, we discovered on the 10th or 11th of January that it was a new SARS, a novel SARS virus, but still, we knew something about other coronaviruses. We had to quickly learn. And so we did several things and put in place several processes and mechanisms to support our colleagues in the emergency division who are responsible for the actual response to the pandemic, but the response has to be based on science. And so we needed to understand, how the virus transmits, what's the epidemiology, global epidemiology looking like. We needed to track the evolution of the virus, and we needed to find vaccines, diagnostics, therapeutics, etc., in addition to all the public health measures. So there's already a mechanism called the R&D blueprint for epidemics that was created after the Ebola outbreak. That immediately came into play. We had the first global convening of scientists in February of 2020 and laid out a research roadmap for the global community on here are all of the unknowns. At that time, almost everything was an unknown. And then we've refreshed that roadmap. And these groups of experts are now numbering in the thousands. We started with a few hundred. They're now in the thousands. They convene on a regular basis, share data, discuss scientific questions. And we've worked with both public and private sector. We've helped to do clinical trials for drugs, particularly the repurposed drugs, where companies were not coming together. It's been a problem. So no head-to-head trials were done except for those that were run by, the WHO and a few other networks. So we worked with regulators around the world also to ensure that we don't delay in the regulatory process, so that once you have a vaccine or a drug that's found to be safe and efficacious by, a good regulator, a stringent regulator, this then gets adopted, because then the WHO actually gives it an emergency use listing, and then it's accepted around the world. So there were many of these innovations that helped to hasten the access to new products. But of course, we also saw the inequities in access, and that was unfortunately a repetition of past behavior where high-income countries actually get to sort of hoard the vaccines or drugs for themselves, and then only when they are sort of satisfied does it start flowing to low-income countries. That needs to change. We tried to set up mechanisms like the COVAX facility to address the issue of inequity, which we had anticipated, but it was, I would say, partially successful.
Right. And I hope the inequities are going to become smaller and smaller, and one day disappear completely. And speaking. And speaking of challenges and how the WHO changed, can you maybe tell us how the actual WHO changed in response to the initial COVID waves, so that we can prepare, so the WHO can prepare better for future potential pandemics?
So I think that the WHO was able to be effective, maybe because of some of the changes that we had done in the previous years during the transformation process. So we had good alignment between the three levels of the organization. I think one of the things we did well was, the guidelines and the standards that we kept on updating from time to time. We introduced a concept called the living guidelines, which meant that every time there was a large clinical trial which sort of updated our evidence base, we could update our guideline without waiting for a complete refresh. So you could go and update, one recommendation to either increase the level of confidence in the use of a drug, or say, well, I think we now know that this drug doesn't work, so we shouldn't use it anymore. And in the beginning, if you remember, there was so much controversy and so much of political interference, I would say, with what should have been a scientific and technical issue. Whether the drug works or doesn't work, it shouldn't depend on somebody's personal opinion or promotion. But unfortunately, all those things were happening in 2020. So not only did we have to do the science, but we had to communicate it. We had to deal with a lot of misinformation, what we call the infodemic sometimes, where people just get confused because there's so much information out there, plus active disinformation. We've seen that with vaccines, but we also saw it with drugs like hydroxychloroquine and ivermectin. So we had to deal with those things. Those were surprising to me. I did not anticipate that we would have to deal with it at such a massive global level. So we had to really up our game in terms of communications, not just to our public health audiences, but to the lay public as well. So we used all the social media channels, to reach out. So I think we learned a lot, and we also, I think, were quite performed quite well in that regard. We also, on the research side, I think did well because, as I said, we worked both with academia but also with the private sector to guide on where the research should be done, and also what the sort of target product profiles should be. We were the first to come out with the target product profile for a COVID vaccine, so that companies who are making the vaccine know what the standards are that they should be. And this was accepted by regulators around the world. So it became easier for manufacturers. So that kind of regulatory harmonization that WHO was also part of doing was, I think, very helpful. And then, of course, I think that WHO was a big voice for equity, and particularly our Director General, has stood up from day one and basically spoken the truth and said, what was going well and what was not going so well, and kept reminding the world that whenever we found that, either there was inequity in access, or even like now when a lot of people think the pandemic is over, people in rich countries are all vaccinated, boosted, people want to move on. But we know the reality is very different in other countries, in the low-income countries. And so having that global view, and even today when we're looking at monkeypox, for example, we see the same thing, monkeypox now in high-income countries in Europe, North America. There's a huge push now to develop vaccines and therapeutics. A lot of research, I think, is going to happen now, which is a very good thing. But all of these years, monkeypox was endemic in several countries in Africa, but there really wasn't a lot of global interest in this. So I think some of these hidden truths are being brought up, and the WHO is, I think, not sparing any efforts to bring these points to the general public in order to change the way that the world actually responds to infectious disease threats. So I think I hope going forward that we will actually put in place mechanisms so that we do not have this type of an uncoordinated response to the next pandemic, which I hope is not going to be soon, but I think we have to prepare.
Right, and since you mentioned monkeypox, just a quick question. Do you anticipate monkeypox to stay contained, or do you expect it maybe to spread, not as COVID, but spread relatively quickly? Or do you expect it to be contained and that we're going to deal with it relatively fine?
I think there's still an opportunity to contain it because it seems to be spreading, at least the current outbreak, within sexual networks largely. And it's still mild, and we know that with isolation, with contact tracing, you can actually sort of prevent the onward spread. And also now, vaccines are going to be used in some places to prevent the onward spread. So it is serious, but at the same time, I don't think that, it's going to be anything like COVID, clearly. Chickenpox has been around for a long time, and countries have learned to live with it. But certainly what we don't want is monkeypox to become established in many countries. And because we know that, again, you can have an animal, there are many animals that can serve as reservoirs, so you may then get endemic transmission happening around the world, which is something it's better to avoid.
Right. And speaking on a more personal level on your motivations, you've gone through so many challenging times in your career as a leader in various healthcare institutions, including now when COVID struck. So what keeps you motivated when times are challenging on a personal level?
Maybe as a scientist, the unknown and that challenge is something that keeps you motivated, right? As long as you have something that you need to solve, then your brain keeps active and you keep thinking about that in different approaches. So I think as far as health is concerned, there are many, many challenges still to solve. I mean, I come from the TB field, as you know, and we still don't have a good vaccine for TB. We still treat people, for long periods of time with drugs that can have side effects. We still cannot predict which individuals are going to progress to TB from latent TB. So there are so many unanswered scientific questions. And that is what keeps me motivated and going. And even during this period of the pandemic, while it was very tiring, very challenging, 24/7, again, I felt that I was part of a team and that together we were making a difference, and that so many people relied on us. They rely on, I think we are relatively fortunate people to be where we are. And so we have a responsibility also to contribute. And because I've traveled widely within India and outside in many communities, and I've seen people struggling with diseases which they shouldn't really be still suffering from, little kids suffering from malaria. I've seen in my own family, family members getting cerebral malaria because they were traveling in endemic regions. So once you've experienced that, then that also motivates you because you feel you're in a position to be able to make a difference. You have to do that. So this is why I still have a lot of energy and I want to keep going and contributing.
And that's really great to hear. And apart from research, science, medicine, do you have any other passions, maybe?
So I think what happens is that you start giving up some of your hobbies because you're so busy. So I used to play the violin, which I gave up quite early on when I joined medical school. Maybe I'll take that back up when I have some more time. I love nature. I love being outdoors. And that gives me a lot of peace as well. So when people say, how did you keep sane during the years of the pandemic? Right. I think it was just being in nature. And every time I needed a break, I would luckily live in a very beautiful environment here in Switzerland. And so I could take a walk and my head would then clear and go out into the mountains whenever possible and things like that. And music, also gives me a lot of joy, and being with family and friends, which has been tough over the last couple of years. So we've had to only connect, online and so on. But yeah, I think somehow we've kept the bonds, even close-knit bonds between friends, thanks to technology.
Right. And do you maybe have, since you had various positions in your career, a very extensive career, do you have any maybe regrets? If you could change something in the past, what would that be, if there is something, on a professional level, of course?
If when I was a young scientist, if somebody had perhaps told me or mentored me, some of the lessons that I learned through experience, perhaps it would have been good to hear early on in my career. When you are designing a research study, make sure that you consult with the communities, who ultimately are the beneficiaries of that research. Make sure that you speak with policymakers who are going to set, because sometimes you go to them at the end of your research and they say, well, if I were to design the study, I would have done it differently because this is the challenge I'm facing. You've answered the wrong question for me. So these were lessons that I learned, especially if you're working in applied research in an area where it has direct implications, for public health policy. If you're doing a piece of upstream research or basic research, then it doesn't matter so much. And I also believe strongly in mentors. And I was lucky to have very good mentors, both during my training, but also during my research career, who gave me the confidence, because again, in the environment in India at that time, things were still sort of dominated, I would say, patriarchal kind of system, where the leadership, you see, is mostly male dominated. And so to be able to be treated as an equal and as a peer, or even as a younger colleague who had expertise in some areas, that was a challenge. And I think it was the mentorship and the support that I had from my boss that gave me the confidence to keep going and not get intimidated. So yeah, I think those really are the important things, which I learned through experience. But yes, and the other thing may be to have international exposure, which again I was lucky to have because I was able to go for my fellowship. But I think just going to another country to see how things are done there, you learn so much, because environments, especially research environments, are very different. And you just learn to be innovative. And you also see sometimes people who are doing very good work in much more difficult circumstances. So sometimes one complains about one's own circumstances and, you don't have enough resources or you don't have enough this or that. But then you see somebody who's living in even more rudimentary and basic setup and still coming up with excellent research. And then you realize that it's not about the facilities that you have. It's about your passion and also the question that you're asking and having a systematic approach to collect that data, analyze it, and use it.
Right. I think your passion for equality can be felt through your answers, which is fantastic. I really think so. And we have like a couple of more minutes left. The last few questions, like one or two questions. So since you were speaking about the importance of your mentors, can you maybe share with us some of the best pieces of advice your mentors gave you, which helped you a lot during your career?
So when I was a fellow, my mentor at the Children's Hospital of Los Angeles, he actually trained me in how to write a good paper and also in how to, of course, how to design, the study, etc. But then how to write it and also how to present at a conference. And that gave me a huge amount of confidence because I knew that he was there, but then he said, no, you have to do it yourself. You have to defend. So present it at a regional meeting first and then at an international meeting. So he taught me to be thorough with the data, to understand the data that I was presenting, to read widely, but then to be very confident and also to be able to accept if there was a question I couldn't answer, to be quite upfront about that. So I think that gave me, it stood me in good stead. And then later on, I was also had this other mentor who I said, as I mentioned, when I was mid-career and working on HIV, there were many times national meetings to which my director should have gone, but then he asked me to go. And I often asked him, said, but nobody's going to listen to me out there because, I don't have the same rank and I'm not at the same level as the other people sitting around that table. And he said, no, but you're the one who's working on this. You're the technical expert. They need to listen to you. So initially it was a bit intimidating, but then, as I said, it would often be a room full of men and they would effectively ignore me sometimes, or I wouldn't have an opportunity to speak. But over time, I learned, that if you know your work, if you know what you're doing, and you're strong technically, then people start respecting you and then asking for your advice. So I think the best advice is, be very good at what you do, understand the disease, also be humble, be willing to accept and learn. I think as a scientist, one always has to be humble because what you believe in today could be overturned by something new tomorrow. So one can never be dogmatic. And also I learned the art, I think, more from my father and observing how he did business, was the art of being able to negotiate and compromise. And when you're in a situation where you can't agree over a particular issue, then you have to agree to disagree, and then maybe approach it from a different perspective. And I always found that speaking to people who came from very different backgrounds and perspectives, like speaking to somebody from the community, for example, an affected individual, or speaking to someone in government, or speaking to someone from the private sector, all of those give you different perspectives, which then help you to shape your own thinking. So as you get more senior and you have to be a policymaker or make decisions that affect a lot of people, it's always good to listen to different voices before making those decisions.
Right. That's great advice. And we have a last set of 5 very short questions with very short answers. So I can start with the first one. Your role model, is it your father or?
It's a combination of my father and mother.
Great. What do you think is the most important leadership skill that one should have in healthcare leadership?
being able to work as a team and being able to lead a team effectively, I think that requires a number of personality attributes, which include being humble and being a good listener. But then you also have to be able to keep the team together and motivated.
And if you were not the chief scientist of the WHO, what would your position be? Where would you be?
Yes, in some ways, this is almost sort of an ideal, position that I could never have imagined in my life that I would be. But otherwise, I would probably be heading a research institute or a research funding institute.
Do you have a favorite quote or a favorite phrase?
Well, I think that, it's a combination of what Mahatma Gandhi actually said. It's what he said when, not in the context of science, but I think it applies to us very much today, is that when you're about to make a decision, then think about the most disadvantaged person that you know or that you've seen, and see whether that decision is going to benefit that individual or how it would change the life of that person. And I think that that's been very, very helpful and motivating to me.
Right. And the last question of the interview, since you've lived in the US and India and Switzerland, do you have a preference? So US, Switzerland, or India?
I love exploring the world and seeing different parts of the world. And each of these countries that you mentioned are beautiful. There's so much to see and explore, and they're so different. So I wouldn't say that I had a preference. Of course, India is my home, and I love being there because that's where I grew up and my family and friends are there. But I've enjoyed my time here in Switzerland. I loved my time in the US. I explored a lot of it, but there's still many parts of the world I haven't seen and I'd love to see.
Great, and I wish you to explore the world as much as you can. Dr. Swaminathan, thank you so much for this interview, and we wish you all the success in your professional career.
Thank you so much. It's been a pleasure.
Thank you.